My name is Emma Mwongela. I currently work at Kenyatta University Teaching, Referral and Research Hospital. I lead the communications and marketing team at KUTRRH, like we like to call it. And basically what we do is tell stories. Our storytelling is based on ways in which we can improve patient outcomes. Number one. Number two, also there's a lot of innovation that happens within KUTRH. We tell stories on that, medical innovations. We also tell stories on patient outcomes, like I've just said. We have a medical, what we call MIA, Medical Acceleration and Innovation Hub, where we house individuals who have ideas on medical innovation in health. We house them there. It's an innovation hub. You come in, if you have an idea, we incubate you for a period of time and help scale your product. We also market the services within the hospital. It's a level 6 referral hospital with a 650 capacity bed. Now, we have services ranging across the board. Being a level 6 hospital, it's the highest tier in healthcare in Kenya. So when you move from your level 2s to your level 5 and you can't get the appropriate healthcare, then you come up to level 6. So my job essentially is just to give the story of KUTRH and what we do. We do a lot. Sometimes the public healthcare space gets a beating and my job is to make sure that people understand that we also add value in terms of healthcare in Kenya. There's been a lot of conversations around the national insurer, for example. I think people don't understand what the national insurer is trying to provide, and again, that is part of what the job that we do is just to educate people on what SHA-SHIF is doing, which is doing a lot. Besides the bad rep that it's getting. And yeah, basically that's what I do. So I just want to say thank you first of all to the KUTRRH Foundry team, especially to Mrs. for inviting me here today. This is something I have not experienced before and I'm very excited to have been part of it. I'm here to, I was one of the judges in the first ever hackathon for KUTRRH Foundry. And I mean, it's been so interesting because we've met 5 teams with diverse areas of interest, and I mean it's just interesting to see where health has come and what solutions that are coming into the health space. First of all, just being in healthcare and seeing, and let me be specific, being in public healthcare. I like I said, I work at KUTRH, and in the public healthcare space, we see a lot of there are lots of challenges. We're obviously doing our best to mitigate them, but the challenges are there. And to have a space like this where medical clinicians are coming together with techies to come up with solutions to bridge these gaps is something I would be interested in anytime. So I mean, it was an honor for me to come. I didn't have to ask me twice. I ran at the chance, and I'm just very, amazed at the kind of solutions that are here today. I will have to say there are two. I know PregMap won today because of the solution that they have around antenatal care, which is a big issue in Africa, not just in Kenya. Antenatal care, we lose a lot of mothers and babies during childbirth, which is something that should not be happening. They gave us a lot of statistics on that, and bridging that gap is something that is welcome anytime. So PregMat had a very good solution, which obviously they won, and we're happy to see that go to scale. But I was also very interested in Kia's solution, again, being in public healthcare and seeing the kind of solutions they were coming up with in sort of reducing long queues that we see every day, where seeing how a patient can sit at the OPD area waiting to see a doctor for hours on end, and then when they go see the doctor, they realize they're actually not seeing the right doctor, how frustrated they get around that. They had a solution for both patients and doctors on how we can be able to mitigate that. And I hope that Kia can be able to just continue building that solution and get it to the point where where it needs to be, because we do need those kind of solutions as in the public system. Obviously also in the private system, but in the public system, when people don't have many options, it's sometimes it breaks my heart to see the kind of challenges that they face there. Yeah. My parting shot here today is that let's just continue building. Let's continue building. Let's not stop building. The challenges that we face in Africa are not challenges that cannot. It's not like we can't come up with these solutions. I think we've seen a lot of builders in Europe and America and the Western countries, get the funding they require to make their systems easier. So why not Kenya? Let me not even say Africa. Why not Kenya? What stops us? And again, kudos to Clutch Foundry and CISA and the team for building this house and giving people an opportunity to come up with these ideas, because we need them, and the future is AI. So yeah, get on board. Yeah.